Today, I will tell you about a simple cup you can drink every day that may help unblock your arteries and improve blood flow. Imagine a single habit that targets the real cause of many heart problems and not just the numbers on a chart. When arteries stiffen and the lining wears down, the first signs are often subtle: shortness of breath walking upstairs, persistent fatigue, and occasional pressure in the chest you ignore. Underneath those signals is damage to the endothelium, the thin cellular lining of your blood vessels, and that damage leads to inflammation, arterial plaque, and an increased risk of clot formation, which can result in heart attack or stroke. Most medical approaches manage symptoms like high blood pressure or high LDL, but rarely zero in on restoring endothelium function and boosting nitric oxide, the molecule that relaxes vessels and prevents clots. The cup I will describe mixes raw cocoa and beetroot with simple cofactors and acts through known pathways to increase nitric oxide and reduce inflammation. There is clinical evidence and plausible physiology behind this, and I will show you how to prepare it, when to drink it, what to look for, and who should avoid it. I will also name studies and experts so you know this is not folklore but applied physiology. When the endothelium is injured, it cannot produce enough nitric oxide, and the result is less vasodilation, more stickiness of platelets, and a tendency for plaque to form and calcify. You can almost picture it as a narrow corridor where the paint peels away and debris collects, creating turbulence. That turbulence raises local pressure and triggers clotting. In practical terms, this shows up as higher systolic readings, more chest discomfort, and a higher risk of acute events. One striking statistic often cited is that around 90% of heart attacks involve a thrombus or clot over a ruptured plaque, which underlines why preventing endothelial damage matters. To visualize the process, think of a smooth river that, with pollution and erosion, becomes shallow and clogged. You can hear the change in the flow, sense a slight roughness under your feet, and if you taste the water, it would be different. Clinically, inflammation is the common thread, and markers like C-reactive protein often rise before cholesterol becomes the clear focus. I will quote a randomized controlled trial from 2017 that tested a polyphenol-rich cocoa extract showing measurable improvements in flow-mediated dilation, a surrogate of endothelial health, within 2 weeks in older adults. Dr. Patel, a cardiologist at a university hospital, reviewed that data with colleagues and described the vasodilatory effect as comparable to light exercise in some measures. Researchers like Dr. Thompson and nutritionists such as Emma have observed similar trends in small trials and pilot studies. Nurse Linda and Carlos, a community health worker, helped run community screening and saw symptomatic improvements in patients like Maria, who reported walking longer distances without windedness. These names connect the science to human stories. So you know this is applied in clinics and neighborhoods, not only in papers. There are natural behaviors and nutrients that boost nitric oxide and support the endothelium. Exposure to sunlight on bare skin stimulates pathways that indirectly support vascular health, and you see a glow on the skin, hear birds outside, and feel the warmth of the sun, which is also a cue for circadian rhythms. Nasal breathing increases local nitric oxide production in the nasal cavity, so breathing through your nose for a few minutes brings a cool airflow, a subtle metallic scent in the nostrils, and a focused sensation in the chest. Magnesium helps enzymes that recycle nitric oxide, and you can feel its effect as relaxed muscles, reduced cramping, and a calmer pulse. Foods rich in nitrates, such as beetroot, convert to nitric oxide and give a sweet, earthy aroma, a deep red color, and a slightly metallic taste when concentrated. Polyphenol-rich foods like raw cocoa provide antioxidants that protect the endothelium and leave a rich, bitter aroma, a velvety mouthfeel, and a pleasant, lingering taste. For dosing practicalities, aim for short sun exposure in the morning, nasal breathing exercises 5 minutes after waking, and a magnesium supplement in doses recommended by a professional, typically 200 to 400 milligrams depending on baseline levels. There is also a process called reverse cholesterol transport that helps the body remove excess cholesterol from arterial walls. HDL behaves like a cleanup crew, picking up cholesterol and carrying it back to the liver where bile helps excrete it. Niacin can raise HDL and assist this process, but must be used under supervision because of side effects. Exercise stimulates HDL and promotes reverse transport, much like a street sweeper clearing debris after rain. Intermittent fasting and a low-carb dietary approach reduce insulin spikes and liver fat, which in turn reduce the amount of VLDL produced by the liver, a major contributor to arterial plaque. Imagine your liver as a factory, and when you reduce the incoming sugar load, the machinery slows down and produces less greasy output that would otherwise clog your arteries. You can sense these changes as reduced bloating, lighter digestion, and steadier energy across the day. Sugar and refined carbs are especially harmful because they act like repeated corrosive insults to the endothelium. High postprandial glucose increases oxidative stress and inflammation, which accelerates plaque formation and calcification. Over time, insulin resistance develops, then fatty liver, and disrupted bile composition, which impairs cholesterol elimination. The smell of a sugary pastry may be pleasant and the momentary taste rewarding, but the biochemical aftermath is a quiet assault on vascular health. Shifting to lower carbohydrate whole foods reduces insulin demand, decreases hepatic fat, and supports bile production and cholesterol removal. Practical swaps include replacing pastries with nuts and berries and choosing whole legumes and vegetables. Now the practical cup recipe I recommend, which I call a morning circulation cup. Use 1 cup 240 to 300 milliliters of warm water, not boiling. Stir in 1 teaspoon of high-quality raw cocoa powder, preferably 100% unsweetened, which brings a deep chocolate aroma and a slightly bitter taste. Add 1 teaspoon of beetroot powder or 2 tablespoons of fresh beet juice, which gives an earthy scent and a sweet finish. Mix in a pinch of magnesium citrate powder, equivalent to 100 milligrams if you tolerate it, which may leave a slightly mineral taste. Add a squeeze of lemon for flavor and vitamin C, which brightens aroma and helps nitrates convert to nitric oxide. Stir until dissolved. Feel the warmth of the cup in your hands. Notice the aroma. Inhale deeply, then sip slowly to notice the taste and mouthfeel. Take it first thing in the morning, at least 90 to 120 minutes before coffee to avoid interference. Use daily for a minimum of 14 days to assess changes. In studies, polyphenol-rich cocoa improved vascular function in 2-week windows, and older adults showed measurable gains in flow-mediated dilation after similar interventions. If you are on anticoagulant medication, consult your doctor because beetroot, high in nitrates, and raw cocoa polyphenols may interact with blood thinning. Also avoid if you have uncontrolled low blood pressure or are on certain medications without medical clearance. If you care about your heart and are listening because you want concrete change, I understand, and you are not alone. Tell me in the comments below when you last had a vascular checkup, or start with the phrase, "I tried," and share what you felt after a week of the cup. Your stories help others and guide future content. Now to close, remember small, consistent practices compound. Try the morning circulation cup for 14 days. Combine it with short sun exposure, nasal breathing, and magnesium, and watch for improved stamina and steadier blood pressure. If you want more science-based routines, subscribe for a 2-week protocol and grocery list in the next video. Caution: consult your physician if you take blood thinners or have chronic conditions. Sometimes the habit you build today is the circulation you will have tomorrow.